you're negotiating prices in a way that hasn't been done prior.
Right. So when you go prior to us, there was no transparency whatsoever, right? And so nobody knew what the price of any medication was.
And it's just run by these boards.
Yeah, these pharmacy benefit managers are dictating prices left and right. They're basically stealing money from employers and employees. And so we walked in there and said, what's the one missing piece? Transparency. So when you go to costplusdrugs.com, you put in the name of the medication you might take. First thing we do is we show you our cost. Then we show you our markup, which is always 15%, and everybody gets the same price.
And this is legal.
Of course it's legal, yeah. It's good old American capitalism. But let me just tell you the impact. There are drugs that, there's a drug called imatinib for chemotherapy. Right. That when we started, the price of imatinib, if you just walked into a big pharmacy, a big chain pharmacy, was going to be $2,000. You go to costplusdrugs.com, it's under $30.
Called rebates.
Our plan will end the dishonest double dealing that allows the middleman to pocket rebates and discounts that should be passed on to consumers and patients.
So how do so-called rebates work? In addition to managing business involving consumers, pharmacies, and insurance plans, PBMs also broker deals between drug makers and insurance plans. For instance, they help decide which drugs will be covered by the plan. The list of covered drugs is called a formulary. In a bid to get a drug on a plan's formulary, drug companies sometimes pay PBMs. These payments are known in the business as rebates, and they can total millions of dollars. PBMs say they pass most of this money on to insurers, who say they use the money to lower copays and premiums for patients.
Another issue that we've been hearing a lot about, that the president has even been talking about, is something called rebates. That sounds like a good thing.
So it certainly does sound like a good thing. Rebate is money back. It could lower price for the consumers. The problem is that in this opaque world where we have no idea what these contracts say, rebates actually can increase price.
Michael Carrier says because these business deals are secret,
pharmacy benefit managers are the middlemen between insurance companies, drug makers, and pharmacies, deciding what meds are covered and how much you pay. But some allege PBMs have gained too much control by owning both pharmacies and the licenses to operate them.
Pharmacy benefit managers have gotten away with this for far too long, and it's about time that Arkansas leads the nation in putting these bad actors to rest and passing House Bill 1150.
That bill is now law, signed by Governor Sanders on Wednesday after lawmakers like Representative Jeremiah Moore pushed for the change.